Hello viewers. Today I am going to describe a very essential topics for each and everybody, and of course for diabetics particularly. Actually, a lot of patients come to our clinic with a question that, sir, I am doing lot of exercise, my sugar should not be there, I don't take medicine, and even few people are so much reluctant that it is very difficult to convince them that take medicine, because they are in belief that exercise or some amount of food restrictions, which they do not know also particularly very well, they do not know, but with little knowledge they will tell that we will restrict the food, we'll do the exercise, and I will not take medicine, sir, again I will try, sir. So that is okay, but for the particularly those patients who are very recent onset of diabetes, very recently they develop diabetes, or they are in pre-diabetes condition, that means they are impending to develop diabetes within 1 year or 6 months or like this. So that type of, in that situation, the correct amount of exercise and correct amount of food, correct food, healthy food may prevent the diabetes. But thing is that once the diabetes is fully established, there is no way that only exercise or food restrictions will control the high blood sugar level. Because in very high blood sugar level, the insulin secreting cells, beta cells in pancreas go fatigued. Fatigue means they are tired. Secretion of insulin, they are secreting insulin, but these insulins may not be effective in target organs. So ultimately that is the state of insulin resistance state. So insulin is released properly, but it is not working in the target organs. So in that condition, hyperinsulinemia or increased blood insulin level occurs, which is giving rise to very obesity, heavy weight, and that will further deteriorate the control of diabetes. So in that situation, there is no way you have to take the help of drugs. There are a lot of drugs nowadays. Long back only 1 or 2 drugs were there, but nowadays lot of drugs are there, very good drugs, very effective drugs, and less amount of side effects, and these are to be taken when it is needed and when it is prescribed by diabetologists. So again, if you are knowing that exercise and diet control, but actually what type of exercise you should do, what amount of exercise you should do, that also to be very much aware. Only with that you should be properly knowledge about exercise. What are the particularly aerobic exercise should be done about 150 minutes per week, or sometimes even 90 or 120 minutes also will do. But thing is that it should not be in one day. It should be divided into 4 or 5 days per week, like this. 4 or 5 days if you do exercise, that is enough, and the time period also to be adjusted, and knowledge should be there. Lot of yogasanas are very much helpful in diabetes if it is correctly done. I can mention few names, and you can see in Google how it is done. So these are Dhanurasana, Ardha Matsyendrasana, Bhumkar, Trikonasana, Surya Namaskar, Bhujangasana. So these things to be practiced at home level, and it is very much comfortable to do. About 15 minutes yogasanas per day is effective. And even you try pranayama, that Rechaka, Puraka, like Bhastrika pranayama, Nadi Shodhana. So these pranayamas are to be practiced at home, and this will stimulate the beta secretion, cell secretion, and diabetes control. But thing is that you should be aware that any things which is beyond your knowledge, if you do exercise, lot of exercise, suppose somebody is telling that, sir, I will do 10 kilometers walk per day, they are getting some credit that I have walked 10 kilometers in one day. So that is not the thing. It should be uniform, and it should be about 3 kilometers. If you walk daily, that is sufficient. And likewise, if you are having some heart problems and complications in diabetes, better to avoid few exercises that will give some serious complications. So you should know what amount of exercise to be done, and if possible you should take advice of some yoga gurus or some doctors also particularly, you can help of some alternative medicine people also to teach, to learn this type of things, which is very much lacking in allopathic medicines. They are not very much aware, but they may not be correctly guided. Another thing is that sometimes if you are having heart problems, if you do a lot of exercise, this may get some complications or heart failure, sudden heart failure, heart attack, may be there. And even if you do medicine also, after taking medicines, if you continue for heavy exercise, that also gives some problem. So you should know how much exercise. Yogasanas should be practiced about 15 minutes per day, and you can practice pranayama also. And these things are to be guided by correct people. You should take help of a correct people who can guide you, or you can take help of the presentation in TVs, presentation in Googles. So that will help you in doing it at home level, home setup also. You can do these yogasanas without any problem. But thing is that if you are having other diseases, you should be much careful about that. Even if there is no other disease, heart disease, or any other disease, kidney disease, any disease, if you are free of any complicating disease of diabetes or very initial stage of the diabetes, then you can do one thing. You can do practice it to a certain limit, not vigorous exercise. Vigorous exercise may give rise to your complicating disease. It will increase your complicating disease like kidney disease or heart disease. Again, if you are taking medicines, immediately if you do exercise, there is chances of hypoglycemia or immediate blood sugar low. So that after taking these medicines, blood sugar lowering medicines, or after taking insulin, if you are taking insulin, then immediately you should not go for exercise. That is another thing. And maintain your food levels, carbohydrates level particularly during the exercise. And if you are doing exercise in fasting level, that will give rise to your chances of hypoglycemia. So you should maintain your food level. You should maintain before. I suggest you, before doing exercise, to take some amount of food, carbohydrates containing food, some amount. So this will prevent any type of hypoglycemia, which is to be this is hypoglycemic attacks or low blood sugar attacks will be prevented. Low blood sugar is very dangerous, remember, than high blood sugar. High blood sugar, there may not be immediate complications, but low blood sugar, immediately a person can die. So always remember that you should prevent hypoglycemia during exercise, during yogasanas practice, and during particularly religious fasting. You should be very much careful of that exercises. Thank you very much for watching this episode. So I'll continue this one by one. Next topic will be soon done. Thank you.